Hello, my name is Dr. Jasmine Patel, and I'm an assistant clinical professor of obstetrics and gynecology at the University of California, Irvine. Today, we will be talking about the COVID virus, the COVID vaccine, and both of their effects on reproductive health. I'd like to thank my co-contributors, the California Refugee Reproductive Health Network, or ReproNet, and the Patient-Centered Outcomes Research Institute. I have no disclosures. Repronet was founded in 2019 to strengthen refugee academic community partnerships and engage in dialogue with refugee communities about their experiences and preferences for sexual and reproductive health and well-woman care. This network includes researchers, refugee women, and health and social services providers who serve refugees. Let's get started. Let's start by talking about the COVID virus. COVID-19 is a new virus that can cause serious infections in people, making it difficult for them to breathe and even kill them. The virus is invisible and is mainly spread by coughing and sneezing, which is why masks can help to prevent the virus from spreading. Unlike bacteria, viruses cannot be treated with antibiotics. The only thing that can fight a virus is a healthy immune system. Vaccines can help you have a healthy immune system, which is why they are so important to fight viruses. In order to make the COVID vaccine, scientists use the spike protein from the COVID virus or its genetic code. The spike protein is not alive and cannot make you get COVID-19. The spike protein cannot hurt your body or your female organs. When a person gets the vaccine, their immune system gets stronger by creating fighter cells against the COVID virus because it recognizes its spike protein. Does anybody have any questions about the COVID virus or the COVID vaccine? Today, we will talk about if the COVID virus and the COVID vaccine can affect your female reproductive organs. As a quick review, here's a picture of your uterus, your tubes, your ovaries, and the rest of your reproductive system. Blood from your period is located inside the uterus, and it sheds when there is no pregnancy. However, when there is a pregnancy, a baby grows in the uterus. Your female reproductive organs are part of pregnancy, periods, fertility, and breastfeeding. Let's start off by talking about COVID in pregnancy. Getting COVID while pregnant is more dangerous than getting it when you're not pregnant. When pregnant, you have a higher risk of needing to be hospitalized or in the ICU, as well as needing machines to keep you alive. There's also a higher chance of death. Your baby may have a miscarriage or be born early and have complications. You may need a cesarean section or have increased bleeding or high blood pressure. This is why wearing a mask and getting the COVID vaccine while pregnant is so important. The COVID vaccine has been shown to be safe for pregnant women. The vaccine helps to lower your risk of getting the COVID virus and the complications related to the virus that we just spoke about. It also helps to pass your fighter cells to your baby so your baby can fight the virus when it is born. The vaccine cannot give your baby the COVID virus, but only the fighter cells your body produces. Now let's talk about periods. Your period is necessary for you able to become pregnant. However, when you are sick, your body is more focused on getting better than having your period. This is why sometimes the COVID virus can affect your period, causing there to be irregular cycles or heavier bleeding. However, most women have no effect on their periods, especially if your symptoms are mild. More research is needed to find out what the long-term effects of the COVID virus are on your periods. Similarly, when you get the vaccine, your body is more focused on creating the fighter cells against the COVID virus to make it stronger. Therefore, some people may experience a change in their periods, but this change is not permanent or long-lasting. It is only temporary, just like the soreness in your arm is temporary and will go away with time. It is safe to get the vaccine when you are on your period. Sometimes wrong information can be spread in the news or social media, and it can be hard to know what is true and what is not true. Regarding periods, you may have heard that being near someone who has received the COVID vaccine can affect your period. However, this is not true. Being near someone who has received the vaccine cannot affect your period. Things that can affect your period, though, are stress, infections, and changes in your diet, among others. Does anybody have any questions about pregnancy or periods? Now let's talk about fertility. Technically speaking, fertility is the ability to become pregnant, and we measure it by seeing if a couple can get pregnant within 1 year of trying. The COVID virus, while theoretically could affect your reproductive organs and fertility, it has not been shown to prevent couples from becoming pregnant. However, the stress on your body from the COVID infection could prevent you from becoming pregnant until you are feeling better. Similarly, the vaccine has less of a chance of impairing fertility since the COVID vaccine does not have a live virus that can attack a woman or a man's reproductive organs. Therefore, the vaccine cannot affect your fertility, and the vaccine does not affect a man's fertility either. You may have heard the myth that the COVID vaccine can affect your fertility by making your body fight itself, but that is not true. The spike protein in the vaccine is not alive. It cannot fight your body or make your body fight itself. In fact, in the studies done on the vaccine, 23 people became pregnant during the study after receiving the vaccine. Even women who were having trouble becoming pregnant before the vaccine became pregnant with a doctor's help after getting the vaccine. Any questions about fertility? In terms of breastfeeding, you can spread the COVID virus to your baby when sick by breathing on your baby. However, the virus does not pass through the breast milk. What is best is to give your baby the fighter cells to protect against COVID by getting the COVID vaccine and allowing the fighter cells to pass through your breast milk along with other fighter cells you have from all the other vaccines that you've gotten in your life. Now that you know the effects of the COVID virus and the vaccine on reproductive health, let's touch on its effects for your children. While many children will recover from the COVID virus, it may have lasting effects we still don't know about. Some children who are already sick with other medical conditions may suffer the worst and may have to be hospitalized. Children can also spread the virus to others in the family who became more sick or even die from the virus. Currently, only the Pfizer vaccine is approved for children greater than 12 years old. Studies have shown it is safe and effective for children 12 years old and up. The COVID vaccine for children older than 12 years can prevent them from getting the virus, being severely ill, or passing it to others. The vaccine will not affect your child's fertility, as the vaccine does not have any live particles that can affect your organs. Any questions on this? There may be some concerns about the risk of death while the COVID virus and the vaccine. Here is a graph showing the risks of dying from having a car accident, getting the COVID virus, and getting the COVID vaccine. Because of the risk of dying from a car accident is so high, we wear seatbelts and we need to have car insurance. Similarly, because the risk of dying from COVID is so high, a safe vaccine has been invented that has had no deaths to help prevent deaths from COVID-19. It can also be hard to know whether what you hear or read is real or fake. That's why it's really important to know where you're getting your information from. When you're reading about scientific information online, it is best to read websites of real scientific organizations, such as the Center for Disease Control or hospitals like the Mayo Clinic. You should be suspicious of stories you only read on Facebook or other social media from your friends. These stories may be written to scare you rather than to tell you the truth. Science is the search for the truth, so it's best to trust the experts. Any questions on this? Let's go over some quiz questions to test what you have learned. Is it true or false? The COVID vaccine can change your female organs. This is false. The COVID vaccine does not create any live material and cannot change or affect your fertility. Next, the COVID virus can cause serious infection and kill you. Correct. The COVID virus can cause serious infections and make you go into the hospital and potentially even need machines to keep you alive. Next, the COVID vaccine can make you infertile. Incorrect. The COVID vaccine does not have anything in it that can attack your body or make you infertile. Next, the COVID vaccine can prevent you from dying of COVID. True. The COVID vaccine has been shown to help decrease the risk of death, especially from COVID-19. Next, pregnant women are at highest risk of COVID and should get the vaccine. This is absolutely true. Thank you for listening. This presentation was prepared in August 2021. I'd like to thank Dr. Heike Peel for help with presenting this topic, as well as being available to address any questions or comments. Here are my references. Thank you for listening.